Hi, I'm Susan Morse. I'm Managing Editor of Healthcare Finance News. I'm here with Nick Knowlton, who is Brightree's Business Development Vice President. He's also Chairman of the Board of Directors of Commonwealth Health Alliance. So welcome, Nick. We're here to talk interoperability today, and I'm wondering if you can tell me a little bit about the work of Brightree and what you do there.
So at Brightree, we're one of the leading providers of IT solutions and services to the post-acute care industry. At Brightree specifically, we focus on the needs of the home medical equipment provider, as well as the home infusion and pharmacy providers. We're a wholly owned subsidiary of ResMed, and our sister company, Matrix Care, is a leader in the post-acute care world as well, providing IT solutions and services for skilled nursing facilities, life plan communities, home health, and hospice providers. So my responsibilities, I actually cover a lot of the interoperability work across those various divisions. And as you mentioned, I'm also the chairman of the board of Commonwealth Health Alliance. We are entirely focused on enabling better interoperability by working with others to break down barriers to good health data exchange. So I've been blessed to be part of Commonwealth since its founding in 2013, and I've been blessed to be part of the Brightree team since joining in 2014.
We all know that COVID-19 is influencing all the work that we do. And I'm wondering if you can tell me how it's affecting what you do with interoperability between hospitals and post-acute care.
I'll tackle that from the national perspective first. As you can well imagine, COVID-19 has created a flurry of activity in the interoperability community. And a lot of that has been driven by your standard public health data type needs. So I think one of the long-term impacts for interoperability policy in the U.S. is going to be taking into account pandemic response type issues that we're seeing now. There's already a lot of groundwork out there and a lot of momentum for building event notification type services. So I think that based on what's happened with COVID, we're going to see a lot more emphasis on leveraging national networks such as Commonwealth and leveraging event notification services to provide updates for patients, allow them to track their own care progression, and allow public health researchers to interact with what's going on with the patients out there. So that's all future, I think, work that is going to come out of this. At Brightree, I think one of the key things that we're noticing is the post-acute care providers who have very often been viewed as the tail end of care delivery in the United States. They're now getting new opportunities to connect to their referral sources. COVID is emphasizing the need for interoperability simply because a lot of the face-to-face interaction that caregivers, such as respiratory therapists or others, can have with patients and that providers of medical equipment and the like can have with their referral sources. They're not allowed to do a lot of that in face-to-face interaction today due to restrictions at hospitals or due to physician practices taking their staff or their entire operations virtual. So COVID is definitely driving a big impact for the need for interoperability tools in post-acute care. And it's also, driving the need for other things that you would expect, like, telehealth and better remote interaction with patients in general.
Yeah, telehealth has been huge in the coronavirus era. And I'm also wondering about prior authorization. Will interoperability help that? I've heard some hospitals have issues just having enough beds and getting the prior authorization. I'm wondering if interoperability can help ease that transaction to get patients into post-acute care.
Yeah, so there are a number of recently announced waivers for CMS and some other payers for relaxing some of their rules around getting patients the care that they need. They realize that this is a time of emergency and their focus is shifting to providers being allowed to do what is best for the patient. But to answer your question about prior authorization and can interoperability help, the answer I think is an emphatic yes. We work on solutions all the time that will allow providers to know with confidence that they can both take care of a patient and obtain reimbursement for the care that they provide those patients. So there is a lot of underpinnings in the healthcare ecosystem to handle better and more robust prior authorization transactions. And I think that one of the long-term impacts of COVID, or we might see those tools that exist today better leverage for solutions that are near and dear to the post-acute provider's heart.
It sounds like the coronavirus pandemic is going to make changes not just now, but down the road for interoperability, and that it changes for the good. Can you talk about how it's evolving and how you see interoperability evolving?
Sure. So I think, interoperability in general has evolved dramatically in the last year, especially between acute and ambulatory care settings and other out-of-hospital care settings, such as the, post-acute provider markets as well. Mm-hmm. I think providers in and out of the health system are recognizing that there are many more opportunities to connect. Last year, we conducted a research study with Porter Research, asking referral sources about their attitude towards interoperability with out-of-hospital care providers. And I think the results were absolutely astounding. Greater than 60% of referral sources surveyed indicated that they would switch post-acute care delivery partners if those post-acute care delivery partners had the opportunity to interoperate with them. And I think this is indicative of a couple of things. Number one, they expect that the care delivered in post-acute become visible to them as part of the patient's journey. And number two, the fact that they would be willing to switch post-acute care provider partners is indicative of the fact that they know that these technologies have reached post-acute. So as we enable more opportunities for providers to connect to their referral sources out there, what we're going to see a lot more of is business traction for the providers who do it right to further their relationship with their referral sources, prove value to them, open up the strong and passionate care that they deliver to patients in post-acute care. I think that the smart providers have already recognized this. We see groups out there moving forward across the board from what we see in home health and hospice to what we see in home medical equipment and pharmacy infusion. They know that these interactions with the referral sources are very important, and now that they have the opportunity to really showcase the care they're delivering and get better information on the patients as they pass to their care in the first place, they're taking advantage of that, and they're changing the way that care is delivered out of the hospital now.
And are there any other interoperability challenges for post-acute care providers that perhaps Brightree is working on, or what you're working on to make their lives easier?
Yeah, so I think we've seen a number of reimbursement changes in post-acute care in the past year. To single one out, PDGM really hit home health starting in January. And that's a big change right before we have something like the coronavirus problem emerge. But basically, it changed the way that care needs to be delivered in a home health environment, compresses their revenue cycle, ties reimbursement directly to the amount of comorbidities and which comorbidities are attached to a patient. So I think certain evolutions like that have driven home a strong need for both obtaining the right clinical information on a patient, but also in post-acute, we know that the workflows are very heavily driven by documentation. While sometimes the overall healthcare spend in post-acute might be smaller than acute, the paperwork requirements to both deliver care and obtain reimbursement are very large in comparison. So when you look at trends such as PDGM, the providers who have responded, to the challenge that evolution calls for, have leveraged interoperability solutions to get a full and complete patient history very early in the process for that episode of care. So before their care providers, for instance, even go out to the patient's home for their first encounter, they're able to access not just the health information that the referral source had on that patient, they're actually able to reach out to the rest of the world and find out where else that patient has been, what comorbidities they may be facing, get insight into medication lists before they drive out to a patient's home and, sometimes get handed a shoebox full of meds that they don't know if the patient is still supposed to be taking or not. So it allows them to, start getting their job done faster. And it also allows them better insight as to, how to operate their business in an efficient and productive manner as well.